and welcome to this policy proposal presentation titled Advocating for Lasting Change. My name is Shelby Usselman, and I'll be your presenter. The setting for this change proposal is Jordan, Minnesota. Jordan is a well-developed city of approximately 6,500 residents near the Twin Cities. While thriving and well-established, a needs assessment revealed an opportunity for improvement in the application of a national emergency preparedness policy at the local community level. The primary purpose of this presentation is to provide an overview of the corresponding change proposal, intended outcomes, and funding needs identified. A windshield survey and environmental strengths, weaknesses, opportunities, and threats analysis of Jordan was performed to identify the determinants that impact the community's health. The data obtained from these types of surveys are used to identify needs, develop goals, and implement interventions to improve the health of the community. Jordan appears to be well-developed and economically stable, as demonstrated by successful businesses, steady growth, and well-maintained occupied housing. A governance structure is noted, as evidenced by the presence of a town hall. The community is a mix of lower, middle, and upper-class residents with numerous options for indoor and outdoor recreation. Primary, secondary, and tertiary education options are located within the city and nearby. St. Francis Health Services and a network of primary, specialty, and acute care systems support health care. While several denominations of Christian churches were noted, there were no synagogues or mosques. A storm warning system is present and snow removal services are available. The city also participates in the Scott County's Code Red Alert program, which notifies residents of weather advisories, boil alerts, and emergencies. The city participates in the state sustainability program called Green Step Cities, aimed at achieving 29 best practices to demonstrate fiscal responsibility, civic innovation, and a reduction in the use of energy. These endeavors support the Healthy People 2030 goal to reduce toxic pollution released into the local environments. Regarding green spaces, the city is located among farmland and contains 16 parks that cover 70 acres of land. Providing safe opportunities for outdoor recreation and walking has been shown to improve overall health and quality of life. The city is connected to the nearby metropolis by a highway system and railway. The city is located within a floodplain and experiences severe winter weather. Despite this, an emergency preparedness plan was not identified, representing a key opportunity for improvement. In addition, the city's National Incident Management System, or NIMS, compliance appears to have lapsed, as evidenced by missing documentation about the city's incident command process and NIMS training. While the city has an established highway and railway system, a public transportation system was not readily identified, indicating a potential opportunity for improvement. Healthcare in rural areas is often complicated by a need to travel for specialty services, limitations in public transportation, and challenging terrain impacted by weather. Considering this disparity, Healthy People 2030 proposed a strategic goal for 60.8% of people to have access to healthcare tools and communication through broadband internet. According to the United States Census Bureau, 85.8% of residents in Jordan have internet and computer access in their homes. This represents a significant strength and opportunity for community health outreach. Rural health organizations hold a critical role in planning disaster responses, as resources are often limited due to isolation. The following slides summarize the emergency preparedness change proposal for Jordan, Minnesota. This change proposal's principal focus is to reestablish NIMS compliance as a first step in establishing an emergency preparedness plan in Jordan, Minnesota. NIMS is a critical policy within the national preparedness system, providing stakeholders with evidence-based practices, training, and language that guides collaborative community efforts in emergent situations. The first step in achieving NIMS compliance on a local level is to designate an emergency manager to oversee the training process and manage the documentation required to utilize government funding. In disaster management, healthcare-initiated centralized leadership is of paramount importance in mitigating diseases. The second step is to identify potential stakeholders and initiate training, provided through free training courses through the FEMA Emergency Management Institute. Success in this step will be bolstered by applying Cotter's change paradigm as a framework for the implementation of effective change. The third step is to apply for an Emergency Management Preparedness Grant, or EMPG, which provides a source of funding to emergency management entities to help them accomplish the national preparedness goal associated with security and resiliency. The West Virginia University Hospitals and Health System utilized Cotter's Change Program to foster stakeholder support and establish an incident command system and address barriers during the recent COVID-19 pandemic. Applying the paradigm, effective change is achieved by identifying urgency, establishing a coalition of stakeholders, generating a collective vision, communicating the vision, empowering stakeholder action, celebrating accomplishments, acknowledging improvements, and incorporating the change process into the culture. This paradigm was applied successfully at West Virginia University Hospital to implement an effective emergency preparedness plan and will be applied as a framework for change in this proposal. The vision is to institute a coalition of community stakeholders committed to attaining the training required to reestablish NIMS compliance to ensure the resilience and sustainability of Jordan. The cornerstone of an effective emergency preparedness plan is a dedicated stakeholder group characterized by a central transformational leadership coalition. Subsequent goals are to designate an emergency manager and health officer, establish a coalition-based incident command system, provide training, and apply for external funding to bolster the resilience and sustainability of the Jordan community. Applying Cotter's paradigm, this vision will be communicated with stakeholders, empowering community involvement on individual micro levels and community-wide macro levels. As previously stated, many rural communities fail to implement a process due to a lack of planning and resources. A significant challenge within the community is a lack of awareness regarding the need for emergency planning, evidenced by stakeholder feedback within the community. Many stakeholders in Jordan acknowledged concerns regarding food security, healthcare access, and mental health, but neglected to identify the impact that a disaster would have on those disparities. According to its manager, the food pantry currently serves 200 families per month on a limited budget. As stated previously, data from the United States Census Bureau indicates that 6.1% of Jordan residents are living in poverty. Marginalized and impoverished individuals are often challenged by disparities in accessing food, housing, and healthcare resources. The healthcare system plays a vital role in mitigating these disparities, but is often isolated from rural communities and limited in resources. This represents a vulnerability that would impair the community's ability to support families during a disaster. A community's level of disaster vulnerability is influenced by its ability to prepare resources, respond to events, and recover from threats. The next slides will provide evidence to support the intended outcomes of this change proposal. Centralized leadership using a transformational approach was cited as an integral component of the West Virginia University Hospital's successful emergency preparedness program. Considering that many community members have already cited resource limitations within the community, these individuals may represent potential coalition stakeholders if a shared vision is established using Cotter's change paradigm. Collaboration, cooperation, and effective teamwork between coalition members are of paramount importance in implementing effective change management. FEMA posits that utilizing a community approach that supports inclusion, representation, and equality aids in recognizing and overcoming barriers that marginalized populations face. To overcome resistance and manage conflicts, coalitions should be comprised of interdisciplinary members communicating on a collaborative framework characterized by reciprocal dialogue and respect. Each member is considered a skilled professional in their respective fields and contributes insights from their distinctive perceptions. A distinct direct benefit of NIMS compliance is that it creates an eligibility opportunity for an Emergency Management Performance Grant, or EMPG, through the Department of Homeland Security and Emergency Management. This provides a foundation and impetus for emergency preparedness planning utilizing evidence-based practice, established training protocols, and funding through the EMPG. The purpose of the grant is to provide funding to organizations to help them attain the national preparedness goal associated with security and resilience. This goal supports the ultimate benefit of this proposal of expanding the community's capability to prevent, mitigate, protect, respond, and recover from hazardous situations that threaten health outcomes. Effective emergency planning, training, and collaboration improve the community's ability to respond to a disaster through efficient resource allocation and mobilization. Minorities and marginalized individuals suffer impaired health outcomes resulting from socioeconomic disparities. In addition to impaired mental health, environmental disasters such as severe winter weather and flooding exacerbate disparities like food insecurity, environmental hazards, and substandard housing. Flooding has been associated with an increased risk of drowning, waterborne illness, and respiratory disease from exposure to damp environments. Severe winter storms are associated with increased mortality and hospitalization rates secondary to exposure to the cold, respiratory illnesses, and cardiac complications. Mental health is also impaired due to stress, isolation, anxiety, and suicidal ideation. Indirect benefits of this change proposal include enhanced emergency preparedness, improved resilience, and better access to disaster resources that facilitate prevention, protection, mitigation, reaction, and recovery from disaster hazards. This improves population health by empowering residents to get involved with emergency planning, improving the efficacy with which they receive aid, and mitigating negative health outcomes through a coordinated community response. Environmental surveys are important because health and well-being are impacted by the environments in which residents dwell. Beyond homes, these environments include workplaces, residential neighborhoods, educational institutions, and places of worship. Crime, poverty, and pollution have a negative effect on these environments, which are more likely to be inhabited by marginalized groups such as racial minorities and those living in poverty. According to the U.S. Census Bureau, the population of Jordan is 12.1% minority and 87.9% white, indicating a limitation in racial and ethnic diversity. Of the 7,000 people who live there, 6.1% live in poverty. This is an improvement over the Healthy People 2030 goal of reducing the percentage of people in poverty to 8%. Impoverished individuals experience barriers to obtaining nutrient-rich food, accessing healthcare, finding affordable housing, and engaging in physical activity. Individuals who can maintain employment are less likely to be impacted by poverty and have an improved capacity to engage in healthy behaviors. Based on this information, it can be concluded that most residents in Jordan are economically stable, but a percentage of the population may be at risk due to socioeconomic disparities. The food pantry is supported by over 100 volunteers and feeds close to 200 families a year on a limited budget, stretching their resources thin, according to the manager. The school system also participates in the Title I food program, which provides students from low-income families with reduced price or free meals. Community support programs and healthcare policies that promote equity have the potential to mitigate the negative effects of poverty by facilitating access to food, healthcare services, affordable houses, and education. While global and national policies set the tone for disaster preparedness, regional application of policies is necessary to facilitate implementation success. Poland has experienced success in ratifying global policy agreements to apply them at local levels and identify vulnerable populations. To gauge the effectiveness of policy application, the World Health Organization developed the Hospital Safety Index, an evaluative tool that delineates a hospital's capacity to operate optimally in the face of a disaster. It can be assumed that similar success could be experienced in the United States if national and global policies were ratified and applied at the local level, governed and monitored by each state. Given the gap in preparedness observed in Jordan, implementing a policy to assess emergency preparedness needs and HSI scores within the state of Minnesota may reveal additional resource and training needs within the state. This would aid in determining the need for additional resources and financial support systems. A community's vulnerability to disasters is subjective to its capability to prepare, respond, and recover. Many rural populations fail to develop an emergency preparedness plan as a result of a lack of planning, experience, and financial resources. Healthcare policies that identify community needs and strive to provide support mitigate some of these limitations. Jordan's financial support system is diverse and includes the local healthcare system, churches in the city, the school system, the food pantry, and local business owners. Despite these services, a significant barrier to change is a lack of resources to support mitigation and recovery efforts within the community as disasters exacerbate resource limitations. Based on these limitations, a primary goal will be to obtain additional funding for the $178,500 budget through a variety of resources, including application for the EMPG, matching funds from the City of Jordan and St. Francis Medical Center, additional grants, corporate sponsorship, fundraising, and in-kind contributions. Human resource budget estimates were obtained from the Public Health Emergency Preparedness Budget Instructions. As previously cited, centralized leadership that fosters a transformational leadership style and reciprocal communication with stakeholders is the foundation of an effective emergency preparedness coalition. The emergency manager leads the members who attain, track, and organize assets such as people, materials, or equipment, and is accountable for submitting documentation to the EMPG Evaluation Board. In emergent situations, coalitions supported by healthcare teams are critical in mitigating threats and subsequent disease. The health officer is a liaison between stakeholders and the healthcare organization and is the incident commander during disasters. Considering that this individual will likely be someone who is already employed within the healthcare system, this budget estimate represents an additional stipend for the role of the health officer. Fringe benefits are calculated at a rate of 36%. Salary, wages, and fringe benefits are proposed as part of the EMPG with matching fund contributions from the City of Jordan Administration and St. Francis Medical Center. The County Aging and Disability Resource Center is a firm that provides expert consultation regarding accommodations for community members with disabilities and chronic conditions. The cost listed includes their initial consultation and review visit. The remainder of the budget accounts for the cost of capital purchases, materials, licenses, and supplies. Estimates were obtained from the Public Health Emergency Preparedness Budget Instructions. The generator will be utilized at the command center where the ArcGIS software is utilized. The software, budgeted for 2 licenses, is used to track community preparedness and assets and is a vital component of the emergency preparedness plan. Corporate sponsorship is listed as another potential source of revenue. Based on the limitations of the food pantry, $50,000 was budgeted for a non-perishable food supply. Additional funding may also be available through a Minnesota Food Shelf Program grant. Rental fees for a climate-controlled storage unit were also included as an annual cost. Finally, the cost to produce and distribute educational pamphlets was included as a means to inform the community about the emergency preparedness plan, available resources, and access to the alert system. In conclusion, although Jordan appears to be well-developed and economically stable, a targeted assessment of the community reveals resource gaps and needs that can be met through change proposals, local policy reform, and additional funding. This improves population health by empowering residents to get involved with emergency planning, improving the efficacy with which they receive aid, and mitigating the negative health outcomes through a coordinated community response. While a warning system and flood insurance are present, the city lacks an emergency preparedness plan and NIMS compliance has lapsed, representing an opportunity for improvement. The principal goals of this proposal are to reestablish NIMS compliance by designating an emergency manager, establishing an incident command coalition, initiating training, and obtaining additional support through policy change and funding. A direct benefit of NIMS compliance is that it creates eligibility for an EMPG through the Department of Homeland Security, providing a foundation for emergency preparedness utilizing evidence-based practices, training protocols, and funding. Cotter's change paradigm is proposed as a change framework led by a centralized, transformational coalition of interdisciplinary leaders. The coalition will be guided by a shared vision to attain the training and funding required to reestablish NIMS compliance to ensure the resilience and sustainability of Jordan. While free training is provided through FEMA, additional resources will be sought through EMPG application and varied financial resources to improve the community's capability to prevent, mitigate, protect, respond, and recover from threats. Thank you so much for your time and attention today. At this time, I'd like to answer any questions that you may have regarding the information that was presented.